Welcome everyone to the event Driving the Circular Economy in Healthcare through Innovation Procurement. I'm pleased to announce the event is co-hosted by Healthcare Without Harm Europe and the EcoQUIP Plus project. So the event of today is divided into two sessions. The first is an open webinar that will last approximately 1 hour, and there will be 3 presentations. One on embedding a circular economy model through sustainable procurement in healthcare, a second presentation introducing innovation procurement, and a third presentation about the joint statement of demand towards zero waste operating theater to see innovation procurement in action. Then some of you will continue the event into a closed forum where we will be divided into 2 breakout rooms, one to discuss innovation procurement processes and the joint statement of demand presented today. And the second is to debate and share experience on circular solutions in healthcare. So those of you that will participate also in the closed forum should receive a reminder with the second link, your private link to connect to the forum in the next hour. So we can make sure that you have it in your inbox before the session. The speakers of today, the first one is myself. I'm Mariana Gamba. I'm Circular Healthcare Program Manager at Healthcare Without Harm Europe. And I will give the presentation about the circular economy model applied into healthcare. And then we have Gaynor, director from Jira Consulting. She has been a pioneering expert in the field of innovation procurement. She's passionate about potential of procurement to drive innovation, to improve public services, address social challenges, and create economic opportunities. And Gaynor has facilitated numerous innovation procurement projects and related capacity building activities across Europe. So it is a pleasure to have Gaynor with us today. The third presentation is from Sam. He is the head of sustainability, the University Hospital Bristol NHS Foundation Trust. And he has worked in environmental roles across the public sector and has been in his current role for over 10 years. Along with tackling carbon emissions through both engineering and behavior change approaches, his efforts are focused on embedding sustainability in activities across the trust. Key sustainability successes at the Trust have been achieved through developing partnerships with organizations across Bristol and beyond. You will see today how he will encourage you to collaborate on the joint statement of demand. So really looking forward to his presentation. Before we dive into the topic, a few words about Healthcare Without Harm Europe. We are a non-profit European network of hospitals, healthcare providers, research and academic institutions, and environmental health organizations. Healthcare Without Harm is a global movement. We have regional offices in Europe, the US, Southeast Asia, and Latin America, and regional partners across the world. We are inspired by the Hippocratic Oath, do not harm to people or the environment. So our vision is that healthcare mobilizes its ethical, economic, and political influence to create an ecologically sustainable, equitable, and healthy world. Our mission is to transform healthcare so that it reduces its environmental footprint, becomes a community anchor for sustainability, and a leader in the global movement for environmental health and justice. We have over 90 members across the European region, reaching almost 5,000 hospitals, health centers, and healthcare providers. As I said before, we are a part of a global movement, the Global Green and Healthy Hospital, which is our implementation arm. And it is made of almost 1,500 members representing over 40,000 hospital and health facilities. Members connect and share experience via the GHH Connect platform. And allow me a bit of self-promotion here. So membership is completely free of charge. So I would strongly encourage you to get in touch and join this community if you're not part of it yet. In the European office, our programmatic work encourages the decarbonization of the healthcare sector, promotes sustainable food production and consumption, and aims to reduce the presence of pharmaceuticals in the environment and exposure to antimicrobial resistance. And as for the topic of the presentation, with our circular healthcare activities, we want to accelerate the transition of healthcare towards a circular economy with toxic-free products where the supply chain is more sustainable, products last longer, and the waste hierarchy is properly respected. And let's see why this is important. So now, who's familiar with our work might be already aware of this number and doesn't need to be convinced. That's great. But just in case, let's briefly recap on why it matters. Healthcare Without Harm released a study in 2019 estimating that the global healthcare sector accounts for 4.4% of total global carbon emissions. If the global healthcare sector were a country, it would be the 5th largest greenhouse gas emitter on the planet. And the evidence also shows that supply chain drives 75% of emissions within EU healthcare. In the process of treating patients, the healthcare sector consumes enormous amount of energy, water, building materials, pharmaceuticals, medical devices, generating waste and polluting the environment. These are some pictures taken during audits executed for Healthcare Without Harm Europe project, but I'm sure that many of you will be familiar with these pictures if you're working in the healthcare sector. This is another picture taken from the audits. How many of you do not know how to deal with all the healthcare packaging anymore? So healthcare is becoming increasingly reliant on single-use disposable products. And we have been experiencing during the pandemic how this made the sector more vulnerable to supply chain disruption and supply shortages. So we think that urgent action is needed to accelerate the transition of healthcare towards a circular economy. Now, the good news is that approximately 10% of GDP in Europe is spent on healthcare, which means that the sector can have a huge political and economic influence. If we look at the public spending, the public procurement, public spending on healthcare is approximately half of public spending in the EU. So healthcare procurement can be a key leverage point for achieving sustainability within the sector and its supply chain. We can start to see sustainable procurement as a preventive medicine. So the process whereby organizations meet their needs for goods, services, works, and utilities in a way that it achieves value for money on a whole life basis. So generating benefits not only for the organization, but also for the society and the economy, whilst minimizing and avoiding damage to the environment. How can we tackle this 75% of the emissions and all the waste and contamination that are coming from the products and services that are consumed by the sector? One way of doing that is by applying the circular economy model to your procurement practices. The circular economy is a model of production and consumption. Strives to maintain usability of existing materials and manufacture products as long as possible through different consumption models like sharing, leasing, reusing, repairing, refurbishing, many R words. With a circular economy, waste is reduced to a minimum. When products can no longer be used or repaired, materials are kept within the economy wherever possible through recycling. So disposable will be the last resort in this approach. And it is important to also recognize that expanding the circularity of products and materials in the healthcare sector through procurement requires also a green chemistry approach. So with the right procurement policy, we can aim to phase out many of the harmful chemicals that can be found in a wide range of products used in healthcare. So by purchasing safer alternatives, we will not only ensure higher safety for patients and healthcare staff, but we will also support greener circularity and sustainability through the increased use of non-toxic, reusable and recyclable materials. Now, it is very important to have this definition engraved in our minds to avoid misleading interpretation of what is considered a circular economy model when we try to apply this concept to healthcare practices. For example, it is often easy for a procurer to fall into the trap of a disposable plastic products for the same disposable item. Yes?
You're getting a bit cut. I'm wondering if it would be better to turn off your camera. Sorry for that.
Sure. How can I do that?
Okay.
Is this better?
Yes, for now, hopefully.
Okay, just give me a shout if it's not good. So I was saying that it is important to keep the definition of the circular economy model engraved in our mind because there is often misleading interpretation of what is considered circular. And for example, many may fall into the trap of replacing a disposable plastic item with another item made of bio-based material, which is again disposable. And we know that this doesn't really solve the problems that we list earlier. So when we talk about circular healthcare, we always emphasize that it is important to prioritize sustainability actions and sustainable procurement strategies that follow the waste hierarchy that we presented in these slides, and try to stay away from short-term or misleading solutions that do not bring the systemic change required. So we want to encourage our members and companies to focus the sustainability efforts and innovation into the first part of the triangle, into the waste prevention. So how does that can look in practice? I'm running a bit short of time, so I will be briefly mentioning a few examples, but you can have a look at the slides and references afterwards. So the objective of this talk is to show that there are safe and efficient ways to apply the waste hierarchy. For example, a considerable amount of waste generated by hospital is unused items. This is often the case for made kits for surgery. So, for example, you could discuss with your procurers and suppliers if all the products that are in these packs are needed or can be supplied in a more efficient way. Or, for instance, another way of avoiding unused items being thrown away is to avoid opening them until they're actually needed for the surgery. So this will require rethinking some standard operating procedure. Wasted unused items do not only come from custom packs. During our waste audits, our participants noted that more wipes were taken out of the box than were needed because of improper packaging. These issues has also been observed with gloves. So, for example, the Skåne region in Sweden found that 6% of their gloves were discarded to them falling on the floor. And I think this is where procurement could come in place and certain criteria can be included to improve the design and functionality of the packaging, for example. There are also many opportunities to reduce the number of products and resources used in the facility. And this can be done by select already the procurement stage, reusable products instead of disposable ones. So we should try to reserve in healthcare single-use item only for essential applications when no viable alternative exists, or where there is for example, proven high risk of infection. For example, textile is one of the product categories where disposable options are becoming more common, but single-use textile is representing a high proportion of the total plastic waste generated in healthcare. Medical protective clothing, drapes, bed pads, you name it. So reusable textile would offer a more sustainable alternative, and not only because of the waste and potential cost reduction, but also because there is a potential to reduce the overall amount of hazardous chemicals that are used to manufacture the product. There are, of course, many reusable options in operating theaters, which can be interesting for the discussion about the operating theaters afterwards. And something to consider are also, for example, reusable sterilization containers as an alternative to blue wraps. Many hospitals worldwide are already successfully using aluminum sterilization containers instead of blue wraps, and they're proving that this approach helps them halving their emissions. Another way to reduce the amount of resources is to discuss with procurers options for reprocessing some of your devices. Medical device reprocessing is a process carried out on a used device in order to allow its safer use, including cleaning, disinfection, sterilization, and other procedure to restore the item and its technical safety and functionality. So the processing and the manufacturing of single-use devices is one of the opportunities for hospital and health systems to minimize waste, achieve their sustainability costs, as well as reduce the cost. I included here an example for a Portuguese hospital that is already using this approach, and then a series of items that you could consider for reprocessing. And then in the waste hierarchy, we come to recycling. And as I said before, I think it is important when it comes to plastic recycling to think whether this is the right choice. Plastic recycling has become a popular approach to sustainability in healthcare. It does not require fundamental changes in consumption or use behavior, but unfortunately, recycling can only provide a partial solution to the problem of plastic waste reduction, especially the current rates of plastic production. So plastic recycling should probably be considered when refusing, reducing, reusing, reprocessing. All the other R's that we explained before are not possible. Or even when the items that are reusable have reached their end of life, it's of course preferable that their components are recycled or repurposed. So when implementing recycling, we have a few recommendations. Try to ensure that your local waste collector accept plastic recycling waste streams, know which type of plastic they accept, and also discuss with them what happens to the plastic once they collect it, and try to clear up any potential misconception regarding plastics coming from healthcare. We know from a report from WTO that 80% of healthcare waste is comparable to domestic waste. Also ensure that plastic does not contain any hazardous chemicals that disqualify them for recycling. For instance, phthalates used in PVC, they can impede recycling or end up in recycled products where they still remain hazardous. And then make sure that there is demand for that recycled plastics, because virgin materials are currently cheaper, making recycled material sometimes less economically attractive. And then if you're going the route of recycling, consider internally within your facility the procedure that you have, because waste should be properly segregated, and educate staff and visitors to segregate waste so that the plastic recycling stream is not contaminated. And also keep in mind that other materials than plastics, such as glass, metals, and paper, have the recycling prospect. So when we presented the waste hierarchy before, I think some materials can be used to replace the plastic items, for example. And finally, do not start this sustainability journey alone. Join our European Healthcare Market Transformation Network. This is a network we launched last year to give the space to our members to share best practices and challenges on sustainable procurement. I will not explain the process into details. You can find that on our website. What is important to remember is that we aim to mobilize the economic influence of the sector, of our members, to drive markets toward the supply of healthier, more sustainable products and services. We would like to transform the healthcare sector and its supply chain. We would like to do that through harmonization of procurement standards and engaging with its supply chain, and give a signal to the market that there is willingness to buy more sustainable products. And finally, my last slide is about innovation, because is what I presented enough? Probably not. And again, Ernst will show you that there are many unmet needs in the sector. And the question here is, how can innovation procurement help us achieve more of this solution? Can we aim towards zero waste? So many of the examples I presented today are actually quite simple solutions, perhaps not particularly innovative, models that have worked well in the past and have proven to still be safe and efficient today. But that perhaps requires a different systemic approach, a change of mindset and behaviors that would move us away from the linear model of take, make, use, and dispose. But we also need to be realistic. We know that currently there are no viable solutions for all the single-use products used in healthcare. So many more sustainable and innovative solutions are needed. And this is why we always say, when reusable or more sustainable alternatives are not yet available on the market, discussion with suppliers and manufacturers are needed to encourage and stimulate further innovation. And with that, I conclude. Apologies for the technological challenges. I hope you could hear me well at the end. And I stop sharing my screen and pass the ball to Gaynor, who will tell us everything about innovation procurement.
Thank you very much, Ariana. That was really, really interesting. And thanks very much for the opportunity to come together with EcoQUIP Plus and Healthcare Without Harm on this webinar. So I'm just going to attempt to go back. Yeah, so it's a real pleasure to be here, and I'm delighted at the response that we've had to this webinar and the number of people that have shown interest. Just a little point about Gera Consulting. We've been working in this field since 2006. So quite a long time. And over that time, it's got this idea of innovation procurement has really progressed, and it's really starting to gain ground across Europe, which is just a really brilliant thing. So I promise that I will try and cover these main points, not necessarily in this order, but just to give you an idea. Normally, we've been working in the field so long that we have actually gained quite a lot of experience in the field, and I would like a few days to sit and talk to you about it, but I have 15 minutes, so I just want to give you a taste of innovation procurement, and hopefully stimulate your interest. Yeah.
Can you, before you start the full presentation, can you go in full mode?
I thought I was. Sorry. Let me just. Let me just ask start again.
Yeah.
Okay, so we're now. Is that?
Yeah, that's perfect.
Yeah, great. Okay, I must have slipped there. I'll basically just want to stimulate your interest to find out some more. And hopefully for those of you joining us in the next section, we can also continue the discussion. So first of all, just to start with a really simple point that, the magnificence of the response to COVID-19 has shown what is possible when we really do need to do something. And there's been organisational, society innovation, individual innovation, and product innovation. And what we see, the message that gives us is that innovation is driven by necessity. But first of all, just thought about what I mean about innovation. This is really about developing new goods and services to meet the unmet needs of an organisation or society. So simply put, it's not innovation for the sake of innovation. This is innovation to actually target a genuine customer need. And the key point with this then is that you need to know what your unmet needs are, and you need to find creative and effective ways of communicating those needs to potential suppliers, and then enabling them, innovating suppliers to compete on an equal playing field. And in a nutshell, that's what the innovation procurement process aims to do. However, we rarely do this. We're not so good at going out and asking the market for what we want. We tend to go to a catalogue of goods and services and think we have to just choose the best we can. And when we don't get this clear communication and engagement with suppliers, suppliers end up having to kind of imagine what it is that we in the public sector and the healthcare sector need, which is just wasting everybody's time, which means that we're not really getting the things we need at the pace at which we need them. One, because we haven't sat down and really distinguished what our unmet needs are. And secondly, we haven't shared those with suppliers. And it also means that a lot of the creativity and money that goes into innovating in the supply chain may fail to reach the market. And this is just a huge shame. And what we know from our experience over the years with innovation procurement is this need not be the case. So let's think about the procurement process. We can so easily hinder innovation just by the way in which we approach a procurement. But what we could do instead is use our procurement processes and the power and potential of procurement to actually provoke some innovation in the supply chain, because there is a huge amount of creativity and innovation potential there. And we just need to find a way of harnessing that. I mean, we can just remove barriers, which will enable new solutions to enter into consideration. So, for example, to allow alternatives to be proposed, to change our selection criteria, for example. So, the reason I want to promote innovation procurement today is because what we've shown is that it can deliver what you need when you need it. Again, if you've sat and thought about what your unmet needs are, at a price that reflects the value that the organisation and society places on them. So if your organisation doesn't actually value zero waste or the circular economy, that's actually quite tricky. So the policy background and the organisational context is really important to innovation procurement. It's unfortunate that the power of procurement is rarely acknowledged within organisations. I mean, I've seen it so often seen as a backroom function, and often increasingly starting to be outsourced, which is, I just think it's a crazy idea to outsource your procurement from your organisation. It is everything that you do. Everything that you see around you has been bought and a choice has been made about it. We also find that procurement tends to, if you like, follow a conveyor belt. Well, that's what we bought last time, so we're going to keep buying it. And there is a lack of engagement with end users. We're not questioning the procurement decisions that were made. And, then suppliers are not informed or engaged. And we have this barrier still all these years later, in that we have this idea that in the public sector we can't talk to suppliers, which is first of all it's wrong, but also it just makes no sense whatsoever. However, we can change this, and if we actually start using procurement in a really creative and positive way, we can demonstrate what's possible. So I want to take you back right to the beginning. And I always go back to this project as a really good example of where we set out. So it's no longer the only example. We've got many examples, but it does have so many useful illustrations. So I'm going to talk about the zero waste mattress problem project that we ran with the Ministry of Justice when we first set out on the innovation procurement journey. So what we needed is somebody who had a problem, and we found that the Ministry of Justice had a big problem. They were sending lots and lots of foam mattresses to landfill every year. And this, at the time, was increasingly out of step with their policy and targets, which was moving towards eliminating waste to landfill. And also, at the time, landfill taxes were coming on board, which was making it just more and more expensive. And it was getting more and more difficult to have people take away the mattresses. So the sustainability policy required a solution. Now, what had been happening is that this problem had been thrown to the sustainability team, to the environmental team, who had simply been looking at disposal at the end of the life of a mattress. But instead, what we did is started talking to everybody involved and found out that this was actually an innovative mattress in its time. It was delivering exactly what it was being asked to do in a extremely long 36-page specification that just seemed to get longer every year. But they hadn't really thought previously about changing what they were buying, changing their approach to procurement. So instead of just working with the sustainability team, we engaged the head of procurement, who was really interested in not only the problem, but actually finding new ways to transform his procurement team and update the approaches that they were taking. So in some cases, in some senses, we really struck lucky with this guy, who was a real asset. What we actually looked at is what was the real cost? And this was a really important part of the discussion, not only the price that was being, that the mattress was being bought for, but what was it actually costing in terms of the disposal as well. We brought together a cross-departmental team, and after a few months, everybody came on board and actually said, yeah, do you know what we need? We need a zero waste mattress. The next step was to say, well, actually, if that's what we need, we better go and talk to suppliers. So we drafted an outcome-based requirement. So this meant that we didn't know what the answer was, but we just knew that the outcome we needed was a zero waste solution. We invented at that point something called a market sounding exercise, sent information out to the market and published a prior information notice in the official journal. And what we knew is that we couldn't, this wasn't going to happen overnight. The supply chain needed time to adjust to this. So we said, okay, well, we're not going to need a solution for 2 years. So that's going to give us plenty of time to engage the supply chain. We had a fantastic response. And a concept viability market consultation event was held and was really well attended by the market. And overall, the response of the market was to the opportunity was more than we could have anticipated. They really loved the approach, and they basically said in the concept workshop, you've got to stop buying mattresses and start buying a whole life managed service. So the next step is pro-innovation tendering. That means removing any potential barriers that would enable an innovative solution to compete on a level playing field. The sort of things that we're talking about here is an outcome-based specification, and this is the one here that we used. So it's a whole life managed service with timely and safe supply and end-of-life management of the zero waste prison mattresses. And we'd like that within 3 years of the contract starting. We want it to be auditable, and we've also got other requirements that we'd like you to build into this solution. Using a dialogue-based procurement procedure helps, and of course the use of non-price-based criteria. And the cost as presented to the customer needed to reflect the whole life cost of ownership. The result, we got a zero waste managed service from the start of the contract, series of innovations, and a cost saving of 5 million euros over the life of the project. And the punchline of the story is it was the same supplier who won the contract. So what does this tell us? You don't ask, you don't get. You kept buying the same thing, and you keep getting the same solution. Nothing changes. You've got to start thinking about what it is that you're really after, and dare to go to the supply chain and ask them to supply it. So we've got 3 distinct phases of innovation procurement: preparation, market engagement, pro-innovation tendering. You've got to understand your needs, tell the supply chain, and then allow them an opportunity to compete equally with established solutions. And suppliers love it. They respond really well, and you probably will get what you ask for. Sometimes, however, and Sam might elaborate a bit on this, the internal barriers are bigger than the supply chain barriers. It is all about changing the way an organisation does something. We wanted to create a safe step-by-step approach, which is what we did, forward commitment procurement procedure, and we're still using this today, even though it just keeps evolving based on our experience. So, in brief, identify your needs, express them in the outcomes, and stop picking the answer before you talk to the supply chain. Make sure that you bring everyone on board from the start, and that was a lesson hard learned. And make sure that you provide early warning and allow time for innovation. Okay. There are now, that's one example of success, and we've just kept going and kept improving the procedure, and we've had many, many successes, and there's a collection of ones relating to healthcare in the EcoQUIP final report, which is the predecessor project of EcoQUIP Plus. So I thought one of the questions that might pop up today is, okay, what's the difference between innovation procurement and sustainable procurement? Innovation procurement, so this is my attempt at this distinction, is innovation procurement drives new solutions to come forward and creates the conditions where they can be brought into an organisation. Sustainable procurement tends to, it's an evolving field, and it's getting more and more sophisticated as time goes on. But typically, it seeks the most environmentally sustainable solution that's already in the market. What I like to see is innovation procurement for sustainability, quality, and efficiency, and pushing the boundaries and leading to better outcomes. And here's just an example from another project that we ran with the Rotherham NHS Foundation Trust and Barts Foundation Trust, which is another example of you get what you ask for. We could have gone out to the market asking for an energy efficient bedhead lamp, but instead we went out to the market and said we wanted a step change in the patient experience and energy efficiency, a future ready biodynamic lighting system. And that was what we got. And that's the difference. And that solution that came forward was then future ready to be able to take on board organic LEDs as they become available and affordable. Something that Ariana alluded to, and I think is really important, and it is this need not only for innovation, but for collaboration. And it's going to be key in the transition to circular economy. We don't need to be doing this on our own. We can be much better at harnessing procurement to drive innovation, not only the selection of the best available, and finding new ways of collaborating, jointly acting together, copying good practice, and sharing ideas. So thank you very much indeed. And just to let you know that if you're interested in finding out more, you can connect with me via LinkedIn, or indeed if you would like to join in the discussion on innovation procurement for sustainability, do join the EcoQUIP Collaborative Buyers Forum on LinkedIn. Thanks very much. I shall now hand over to Sam.
Thank you. So you've now heard from the experts. Ariana's really useful background and Gaynor on the details of this process. Now I'm going to lead you into how we actual project of what we've been working on. Let me just start that. There we go. So I've been working in environmental roles for quite a long time, about 20 years, last 10 years in healthcare, which is complex. Sorry,
we can still see the PowerPoint.
Oh, right, sorry.
Can go into...
Let me... Is that better?
No. Maybe try to reshare your screen again.
Yeah, okay.
You should have, yeah.
Okay. Let me try this. Is that working?
Yes, it's perfect.
Great, thank you.
Thank you very much. Sorry for interrupting.
No, I appreciate it. So yeah, working in complex healthcare, which has only really recently recognised the importance of environmental issues, is a really challenging environment. So it's not easy working in sustainability, where we have to deal with these complex, wicked problems like climate change. And the thing with these problems is we don't know the answers to them. But there is somebody out there who does. And I think this is why this collaborative innovation procurement approach really appeals to me. So our problem, the plastic problem. Well, Anna has given some really useful background into the plastic problem. I mean, it's fantastic material that is really important in modern healthcare, but it's hugely energy intensive, it's polluting, it causes greenhouse gases, and it results in huge amounts of waste. In fact, we're expecting by 2050, there'll be more plastic in our oceans than fish, which is terrifying. The emissions from the pollution are a huge impact on health. And the health system produces, in the UK, produces huge amounts of plastic. And a significant amount of that is in our operating theatres. Much of this is single-use plastic. So we've got a huge problem. And you've heard a lot about this already, the process. So this is the summary slide of all the innovation process. We're going into the year 2 part of this now. And I'll lead you through where we are, how we've got to this stage. So first bit was, how do we identify our unmet need? This was our initial starting point, where we started to just recognize the issues and pick out, yep, we know we've got a big problem with plastic. And how do we get away from this? And we're now starting from that. We then realized we really need to get all the stakeholders involved to be able to understand it. Key to this was our theatre staff, because we decided to focus on operating theatres, waste management, and bringing in others. The expertise from Healthcare Without Harm has all been fed into getting an understanding of what our need is about plastics and waste in general. And the key thing is we've actually discovered the complexity of it, and how many different aspects of it there are. So this is what we came up with. We wanted to work towards becoming zero waste operating theatres. The key bit, I think, in defining it is, as Gaynor picked up, is really not specifying the solution. That the temptation all the way through this process is to to come up with the answer, but it's a kind of act of faith that the answer is out there, or else it could be innovated. And I think this goes back to my experience in sustainability, that you've just got to believe that there are solutions out there, but you might not know what they are. I think this is one of the areas where our procurement colleagues really find it quite challenging, because it's a really different way of looking at things. So the unmet need is to find new or alternative products or services. Sorry, that's my phone. That will support a transition to zero waste operating theatres. We've kept it a really broad statement as that initial view of things. Key to defining it is actually looking at outcomes. What do we want as outcomes? So we really want to show the complexity of it. The complexity is looking at the whole life cycle of the product or service. And this really makes you think beyond just the immediate supplier and looking up and downstream. So we've got the basic idea of minimizing the amount of single-use plastic, eliminating all the packaging associated with it, the waste, the potential reprocessing, making reuse of some of those plastics, and getting rid of any of the final waste. So essentially look at the waste hierarchy. And it's how do we get a really clear route to zero waste, not just a one-off reduction. We want to follow that waste hierarchy, keep the items as much in our reuse economy, but at the same time, we've got to make sure we are ensuring patient safety, not compromising outcomes, keeping our carbon emissions as low as possible, minimizing any other environmental or health impacts, meeting all the standards, showing life cycle efficiencies, saving money, hopefully, respecting human rights. So there's all sorts of complexities. And it's not just a simple specify a solution, it's coming up with those outcomes. We also, I think absolutely crucially through this process, identified we need a fundamental rethink of how we consume things and our waste management, and how we work towards a environmentally sustainable waste reduction and management service, which is a whole nother stream that's developed out of this project. So we need to show that there is a wider demand, getting others interested. I like this picture because it showed, lots of people interested in what's going on. So we've produced this joint statement of demand so that we can engage other hospitals and healthcare advisors in the UK and beyond, that see if they have the same or similar needs. And this is really important as part of the process, because to get suppliers interested and involved, we need to show that there's this wider potential market that will enable that investment in coming up with innovative solutions, and to show that it's economically viable to do that. I mean, we put this statement of demand out to our networks, and even before we'd put it out, we had 13 organizations expressing interest and lots of responses to the survey since. So this is the bit I'm reaching out to you. If you share these needs, then I'd really encourage you to read the documents. There's a short survey which enables you to put your views in and express your interest. It's not a commitment to buy, but we just want to be able to show the market that we're really, there's a huge demand for this. So we've had considerable interest already, and it's already started interest from suppliers who have heard about this. I've got this timeline, which is possibly a bit small for you to see. But the next steps are basically to move to the market engagement stage, getting that message out to the market. And it's kind of a little bit scary at this point, because is there going to be an answer out there? We don't know. I'm just got to have faith that there will be. And there's such a huge potential of different products or services that it could be attracted to. Identifying the potential suppliers is tricky in some ways, because we're not looking for necessarily a new specialist. It could well be innovation by existing suppliers, as in the mattress example. I know somebody's mentioned about the existing frameworks that are out there. Well, I see those actually, they're just ongoing, they are suppliers. And if they want to innovate and move with us, they're going to have to provide the products that we're after and come up with those outcomes. So we're about to go out to the market with put this information out there. We wanted to put out an advance notice, a PIN notice, to say this. And this is where we hit a bit of a challenge. Our procurement staff, the operational side, who would produce that advance notice, hadn't been fully engaged with this project. The higher levels of the procurement had been involved, but the operational side hadn't. And so when we asked, we wanted to put out a PIN notice, there was this significant resistance. I think they are very overworked, and they saw this as a huge amount of work, and they didn't understand the process. So we had lots of reasons why it wouldn't work, and they just want to run a traditional, send out a specification and tender. They weren't ready for that act of faith in the process, and I understand that it's scary and different. But I think actually the most important part of this is actually learning this innovation procurement approach, because I can see it being hugely valuable in solving other complex problems going forward. So it's absolutely crucial we get them on board. Our decision making up to this point had been a small group with the approvals had gone through, which had been part of our Sustainable Procurement Working Group, which included the Deputy Director of Procurement, but not all the key stakeholders, including the operational procurement staff. So we took a step back and we set up a project board dedicated to this with all the stakeholders. We've got the terms of reference agreed, and the first meeting should take place very soon. So we're almost at that stage, the exciting phase, I see it as, of getting the market sounding out there and starting to engage the market. And this is, I see the scary bit, but also the most exciting, to start to find out what is possible, what solutions are out there, and then respond to that and develop our procurement strategy and our specification once we've got through that stage. And then actually launch the tenders and the specifications out to the market with what we've worked out is available and possible. So it's an exciting moment, but it is rather scary. This pro-innovation process isn't easy, but I have faith that the solutions are out there and we just need to enable them. Thank you.
Thank you very much, Sam, for this presentation and for showing us the joint statement for demand. And thank you very much also, Gaynor, for your insight into innovation procurement. I think we still have time for a couple of questions, but not. We try to answer most of them through the chat because we want to, through the Q&A, and because we want to close on time for the second session. So I have one here, Gaynor, it's about the EcoQUIP Plus project. And the question is if the EcoQUIP case referring to the so-called outcome-driven innovation is by Anthony Orwick. The person asked, it sounds very familiar with unmet needs and don't focus on the solution, but on the job you do and its unmet needs. I don't know if you want to comment on that.
Yeah, I can do. I mean, it's not. It sounds exactly right, doesn't it? Yeah.
Yeah.
But there is just relying on outcome-based specifications. I think is brilliant. It's better than not. But I think you can do more than that. I think you can do more than that. And also, it's not trivial coming up with an outcome-based specification. I do know that. Charles Edqvist in Sweden is pushing a sort of functional specification approach through their procurement process, an academic pushing that approach there. And we've had several debates on this. It's not in that it is one of the tools in the armory. And actually, there have been several projects where by the time we've done the outcome-based requirement to the market, the right thing to do at the procurement stage was actually not an outcome-based specification. So it's a process of understanding what's going on and what is required in order to achieve what it is that you want to achieve. But in principle, absolutely, you give the market a chance to come up with a solution and not prescribe it. The example, the horror of seeing, I remember it was in the days of fax machines, and I remember seeing this specification for mattresses, and it just kept coming and coming and coming through the fax machine, and we got it down to one page. And that was the right approach for that. But working in something like in the hydrogen fuel cells, buses, you by the time you've done the market engagement, you're really clear that you want a hydrogen fuel cell bus because it actually fits with your energy infrastructure. So it's pretty much out that horses for course tree. Sorry, that was a really long answer, wasn't it? But you get the idea.
Thank you. Yeah, I think it was a good answer. I also have.
I did see there was quite a few comments about supply chain in there. Do you want me to address some of those?
Yeah, I don't know if either you or Sam would like to comment on that.
I'll start, Sam.
Okay.
You can carry on. First of all, I did want to give Sam a huge amount of credit for what he's done to help us get the work going and underway and progressed in Bristol, because this project kicked off in January 2020. So we actually had a kick-off meeting in Brussels, and that was the last time I travelled. And so doing this type of work in that context was significantly, as you can imagine, more challenging than normal. The ability to get the right stakeholders in the room, impossible. On Zoom, pretty much impossible until after the summer last year. So I just want to give him a real shout out for everything he's done to progress that. From the beginning, I started reaching out to NHS supply chain because obviously, that's where a lot of the theatre service goods are bought via their frameworks. And what became clear is that when you look at the list of products and, we said, okay, well, just give us some examples of the sort of things that are bought, send us a screenshot of what's available. What was startling to me not only was the complexity and just the impenetrability of the way in which the products were listed, but the fact that it was completely and utterly impossible to tell which was the greener option. There was absolutely no distinction made And that's where they are, and that's where they still are now. But we are progressing a conversation. There are changes going on in NHS supply chain, and I think, if I understand correctly, NHS England NHS Improvement will become a shareholder in supply chain, is my understanding. Which I think is going to make that has to make a difference. The sort of conversation that we're having is that for the innovation within the supply chain, I think it's going to be fascinating to see. I think some of it is probably not going to look that innovative, and some of it will. There's going to be a mix out there. We've gone out deliberately very broad, and actually, where we're starting, if we were to start to imagine what might come through this project, is that if we hoped we might move towards a green framework for zero waste theatres, that would be great. So we need to start thinking very carefully what the criteria are. We'd want progressive criteria, and so that the suppliers could transition to a more popular with buyers framework. So that means promoting that framework to buyers. I think things like making very visible carbon savings by making these procurement choices would be very attractive to the NHS in trying to demonstrate what different trusts are doing in order to reduce their carbon emissions. So I think there's scope. I think this has got legs, and it's got way to go. The response that we've had, I've never, ever had such a positive response from the wider market, so other NHS trusts, and we're hoping other healthcare organisations across Europe. To get them so many engaged, this has to be the way forward, doesn't it?
Yeah.
But they're not doing it yet. But they're not doing it yet, and they're being too slow.
Yeah.
They need to speed up.
Let's see if we can speed this up also during the conversation. Sam, a last comment from your end before we move to the closed forum on this topic.
Yeah, I think this NHS supply chain isn't moving fast enough, and what this does is treat them as just another supplier, and we are going out and we're showing a strong voice across the NHS and beyond that actually we have a need and they're not providing it. So it's really interesting to see how much interest it's generating from them and from NHS England to actually move the whole agenda forward. And I think that's what the power of this project is actually driving NHS supply chain to start to meet our actual needs. So it's a kind of pressure movement, and I really hope and believe that they will get on board and start meeting those needs going forward, and look at this in a much wider context of green frameworks and providing those products and services that we want.
Great, excellent. Thank you very much for your answer, both Sam and Gaynor. So we are a bit late, so I would like to close this open webinar here. Thank you very much again to the presenters and to the attendees for the many interesting questions. And we hope we have learned something new today, and we'll have some ideas to bring back to our work. So thank you very much again, and see you soon. Bye.